These two videos aim to provide some general information literacy tips, rather than a guide to a particular database. So I'll carry out the initial search in an EBSCO database and show the second part of the search in ProQuest, so that you can see a variety of interfaces. Some databases don't support thesaurus searching, so in this video we'll find our alternate search terms by looking for clues within our search results. We'll work with a general health and social care topic, discharge of patients into the community. We need to find as much of the relevant literature as possible, so we need to be thorough and systematic. We start off by typing in patient discharge. We get 13,000 results, which might sound like a lot, but to make sure we get all the articles that talk about this particular concept, we need to make sure that we're actively searching for all the words and phrases used to describe it by the authors and by the database itself. Looking at the search results, we can see that one of the articles is tagged with the subject heading Discharge Planning. This sounds relevant to our topic, so we'll add this new concept into the first row, joining the phrases with an OR. When we hit search, we get more results because we're offering the database alternate phrases to search for. Now we can add our second concept, community, into the second row. This time we'll retrieve fewer results because we're now asking the database to give us articles that talk about two different concepts. These are joined with AND. Again, we need to think of similar words to use in addition to community, and we can look for some ideas in our search results. One article is tagged with the subject heading Aftercare, and we can check the thesaurus to see exactly what the database means by this. Another word that crops up is home, both in an article title and in a subject heading, and this will clearly be an appropriate alternate term to add into our second row. We'll go into the thesaurus and search for aftercare. It appears at the top of the list, and a scope note to the right gives us Sinnel's definition. Someone being discharged from hospital may require aftercare in the community, so I think it's okay to add this term into our second row. Again, when we search for alternate words, we get more hits because we're being less choosy about how we want the concept expressed. Hopefully, we've now found all the articles on our topic within this database, though to make it a comprehensive search, we'd need to repeat it in all relevant databases. Our problem now is that we've got 5,000 articles, which is too many for an undergraduate dissertation. So perhaps we can focus our topic by choosing a third concept. Again, we can look in our results for some ideas. The first article mentions surgery. Perhaps the patient is leaving hospital following a hip operation. Another article mentions stroke. One of these concepts would be suitable to add into our third row, so that our search results are focused on a particular group of the population. We'll try hip replacement as a possible third concept. The results also mention hip fractures as another alternative. Either would make an acceptable topic. Alternately, we could try stroke. There are still lots of articles, so perhaps we can add a fourth concept. Scrolling down the page shows that one of the articles refers to family. Perhaps we could add family into the fourth row and focus our search topic slightly so that we're investigating stroke patients who've been discharged from hospital into the care of their family.